Like and subscribe and click the bell icon to get new video updates.
Ailing WA health system gets $252 million budget boost amid pressure on emergency departments. The WA government has vowed to spend $252 million trying to address issues in the state's struggling health system, as the health minister took aim at the Commonwealth for the abject failure to manage some patients. There is funding for 17 projects, with $74 million aimed at long-stay patients. Premier Mark McGowan said the funding, part of next week's budget, would help address many of the pressures hospitals were under, particularly in emergency departments. He continued to point to staff furlough, unprecedented demand and COVID-19 control measures as key reasons for those stresses. In recent weeks, the pressures on hospitals have been highlighted by 2 deaths while patients waited for care in Geraldton and Busselton. Ambulance ramping figures also continue to show the strain, having increased significantly since mid-2020. The funding announced today will be shared across 17 projects, including $74.1 million to help move long-stay patients out of hospitals. They are often waiting for aged care placements or placement with NDIS packages, Health Minister Jade Sanderson said. This is an abject failure of those Commonwealth agencies. She said that money would go towards 120 aged care beds to get patients out of hospital, and $5.8 million to help address barriers stopping people from leaving hospital. Not only does that free up beds, but importantly it provides a better quality of life for those patients who don't want to be in hospital, and don't need to be in hospital, she said. More nurses for emergency wards. An additional $55.8 million commitment was made to put registered nurses in 15 metropolitan and regional emergency department waiting rooms 24/7. That was a recommendation made in the wake of the death of 7-year-old Aishwarya Aswath at Perth Children's Hospital last year. Last month, 2 nurses told the ABC a similar position at Royal Perth Hospital, RPH, was often left unstaffed. At the time, an RPH spokeswoman said while that nurse was briefly moved to a COVID-19 triage tent, it had subsequently been expanded to both the main waiting room and the tent. Many of the other measures announced today were targeted at reducing the number of people presenting to emergency departments for treatment. That includes a $55.2 million boost to telehealth, with much of that money going to continuing a COVID-19 home monitoring program. More than $10 million will go to video and phone support for children and families transitioning between services, and $5 million has been set aside for telehealth mental health support in the regions. Virtual triage scheme to be expanded. A virtual triage system will also be expanded beyond its initial trial at Fiona Stanley Hospital. Ms Sanderson said in a year it had diverted 1,000 patients heading to the hospital SED via ambulance to either a ward or another service. But she was quick to temper expectations, explaining the changes would take some time to filter through. Addressing the root cause of the challenges facing our emergency departments will take time, but the first stage of this will be implemented as part of this budget, Ms Sanderson said. We don't expect great improvement in the coming months, given we're still in very high caseload numbers of COVID and we are coming into our winter season, which traditionally sees higher numbers of ramping. Read more. But she said with commitments already made to increase the number of beds and staff in the system, this was the next stage in addressing issues in hospitals. One part of it is resourcing the systems, but another part is just having good systems, she said. What I want to see as minister is a coordinated system that is working together to make sure we can divert patients to the most appropriate care. The implementation of the changes will be overseen by a ministerial taskforce, led by Ms Sanderson. The taskforce will identify sustainable and enduring policies to relieve some of that pressure on emergency departments, she said. In the meantime, we will implement stage 1 of the reforms. Ms Sanderson said the taskforce would include the leaders of North, South and East Metropolitan Health Services, as well as other stakeholders. A business case will also be developed for a centralized state health operations center, with the capacity to oversee the entire state's health system and manage resources. More hospital beds needed. AMA. The extra money has been welcomed by Australian Medical Association WA President Mark Duncan-Smith, but he said it would not address the core underlying issue. The lack of beds is the primary cause of ramping, and we're not seeing a huge amount in this plan that will increase capacity, he said. But Dr. Duncan-Smith was pleased to see Ms Sanderson chair the ministerial task force to try and address many of the issues.